Senior journalist Rajdeep Sardesai was recently diagnosed with prostatic cancer, and this was announced on social media by himself. So, what's the prostate cancer? The prostate cancer is second most common cancer in men. 1 in 8 men in their lifetime can develop prostatic cancer. Now, what's the prostate? Prostate is a gland that is situated just below the urinary bladder, and it surrounds the urethra through which the urine passes. What is the function of the prostate? The function of the prostate helps in reproduction in men, and the fluid that secretes, it keeps the sperm healthy. Now, at what age it can develop? Usually after 50 it can develop. It is the one of the slowest growing cancer in the man's body. Now, what should be the symptoms of prostate cancer? The common and most common symptoms are frequency of the urination, night frequency of the urination, then sometimes there may be blood in the urine. How to diagnose the prostate cancer? First and foremost is the examination. Surgeon examines by putting his finger in the rectum of a patient, and he can judge if there is any possibility of prostatic cancer. The most important and simple investigation to diagnose or to suspect prostatic cancer is blood examination. That is examination of serum PSA, that is prostatic specific antigen, and it should be checked regularly. Then becomes the ultrasonography, that also can be done by from above or through the rectum. It gives a lot of idea. The specific investigation is MRI of the prostate, and if there is a suspicion of the disease like cancer is spread to the bones or any other organs, then PET scan should be done. Once there is a strong suspicion of prostatic cancer, then the biopsy is a must. The biopsy is taken by surgeon through the rectum with a special needle, and that is sent to the laboratory, and that will confirm whether the patient is having prostatic cancer or not. Now, coming to the treatment of the prostate cancer, it depends on the stage of the disease. Like if it is too early, very small and limited to the prostate itself, then conservative, means just wait and watch policy with regular follow-up investigation. Then depends on the further stage, it can be castration, means removal of the testis of the patient, that is orchiectomy we call it. The orchiectomy can be done by two methods: chemical methods and surgical methods. Chemical methods, we use the anti-androgen hormones. The definitive treatment is removal of the prostate, that is known as prostatectomy. It can be done by various techniques like open method, that cutting. The second is laparoscopic, and now the gold standard treatment for the prostate cancer is surgery by the robotic technique. That gives the best result. Take home message for every man is get the serum PSA blood test done regularly, and if there is a strong family history, then they should take more precautions. Thank you and goodbye. Have a good health.